Thank the gentleman for yielding, and I think this is really very straightforward, and it is very fundamental. Read the words of the amendment by Dr. Gingrey. It says that a federal employee or political appointee may not dictate how a medical provider practices medicine. If you oppose that, then you have decided that a federal bureaucrat should be able to, can dictate how a medical provider practices medicine. If you're going to do that, then you're going to assume medical liability for every decision that you mandate. This has nothing to do with suggesting best practices. This has nothing to do with informing doctors of what is the least expensive form of care or the most effective form of care. Indeed, if a doctor were advised that the best practice was to do what was suggested and then he didn't do it or she didn't do it, that would be malpractice if it in fact caused any harm, and indeed they could seek a remedy for that. This is not a question of innovation. Indeed, innovation can come from doctors as well as from government boards. But the question is, do you want to put the doctor between, to put the federal government between a patient and his or her doctor? I would suggest to you that the practice of medicine is in part science, where we can make suggestions as a federal government to doctors as to what they should or shouldn't do, what's cost effective and what isn't cost effective. But if you think that we should have federal employees telling doctors how to practice medicine, then we are abandoning medicine as is taught in America's medical schools in this country, and I think the AMA better listen up, because you're embracing the notion that a bureaucrat is going to tell your doctor how to practice medicine. If that happens, we're giving up all form. Pick up a dictionary, look up the word dictate. It says mandate, command, compel. Read how. It's clear. Should we give this power to the government or keep it in the hands of doctors? I yield back